Dear students, welcome back. In the previous session, we have discussed about lumbar flexus. Now, in this session, we are going to discuss about the abdominal aorta, its chords and its branches. Okay. Now, this abdominal aorta begins in the midline at the aortic opening of the diaphragm. Actually, this abdominal aorta is the continuation of thoracic aorta, which is a descending aorta. Okay, so the descending aorta, when it is present in thorax, it is called as thoracic aorta, and once it enters into the abdomen, then it is called abdominal aorta. So, at which point this aorta entering into the abdomen? So here the aorta begins to enter in the midline of the aortic opening of the diaphragm, which is exactly opposite to the lower border of the T12 vertebrae. At the T12 vertebrae, you'll find this opening, aortic opening of the diaphragm. Next, it runs downwards. So this abdominal aorta runs downwards and slightly to the left and in front of the lumbar vertebrae, and it ends in front of the lower part of L4 vertebrae, which is present lateral to the median midline. How much distance? 1.25 centimeters to the left of the median plane. At this point, so this abdominal aorta dividing into right and left common iliac arteries. Okay, due to the forward convexity of the lumbar vertebrae, so the aortic pulsations can be felt in the region of the umbilicus, particularly in the slim persons. So this is about the course, beginning, course and termination of the abdominal aorta. Now we will see the branches of abdominal aorta. Yes, here we can see the branches. So the abdominal aorta are classified into, the branches of abdominal aorta are classified into 4 types. One is the ventral branches, okay, and the lateral branches, terminal branches and the dorsal branches. Here we can't see the dorsal branches, but we can see on the posterior aspect. So here some of the dotted lines are mentioned here. Those are called as the dorsal branches. Okay. Yes. Now we will see what are the ventral branches, lateral branches and dorsal and terminal branches. Okay. So the ventral branches are mainly very important. The ventral branches are mainly 3 types. They are, the first one is the celiac trunk. So first one is the celiac trunk, and next one is the superior mesenteric artery. Okay, next the third one is the inferior mesenteric artery. So these are the ventral branches. Actually, the testicular or ovarian arteries, so these are also arising from the anterior aspect of the aorta because of its course towards the lateral side. So they are kept under lateral branches. Actually, the ovarian and the testicular arteries are arising on the ventral aspect of the aorta. Okay, so what are the branches, ventral branches, which are arising from the abdominal aorta? Or one is the celiac trunk, superior mesenteric artery and inferior mesenteric artery, and also testicular or ovarian arteries also. Okay, so because of its course, they are kept under lateral branches. Okay, if you see all these branches, all the three are unpaired. All the three are unpaired arteries. Okay, unpaired. Only single arteries are present. Single trunk and single superior artery and inferior artery. Except this testicular and ovarian artery. So these are paired ones. Okay, yes. Now we will move on to the lateral branches. So what are the lateral branches? So the lateral branches are from it. These are the lateral branches present both on right and left side. So the first one is the inferior phrenic arteries. So these are the inferior phrenic arteries. Okay, so these two arteries which arise somewhat above the celiac trunk. Okay, next one is the middle suprarenal arteries. So these are the middle suprarenal arteries. These middle suprarenal arteries which are arising in between the celiac trunk and superior mesenteric arteries. Okay, so above the celiac trunk we will find the inferior phrenic arteries, and in between the celiac and the superior mesenteric artery on the lateral aspect we will find the middle suprarenal arteries. Okay, and then next one, so normally the testicular arteries, because of its course, they have considered here. Okay, next one is the dorsal branches. The dorsal branches we can see separately, and then now we are going to see the terminal branches. So if you see the terminal branches, so the terminal part of the abdominal aorta, I have already mentioned in the termination of the abdominal artery, they are divided into common iliac arteries. A pair of common iliac arteries which is present both on right and left. If you see all these arteries, lateral branches, all these lateral branches are paired arteries. So what are the branches here? Paired branches which are arising from the lateral side. Okay, and on the lateral side we can also find this renal artery. So on both the sides we can find the renal arteries also. This is the major artery which supplies to the kidneys. Okay, so what are the lateral branches? Inferior phrenic, next comes to the middle suprarenal and renal arteries, and the renal arteries afterwards we can find this testicular or ovarian arteries. Because of its course we can consider here in the lateral branches. So here if you can see, this inferior phrenic artery arises above the celiac trunk on the lateral sides of the above the celiac trunk, and middle suprarenal on either side of the abdominal aorta in between the celiac and the superior mesenteric artery. If you see the renal artery below the superior mesenteric artery, a pair of renal arteries are present. Okay, now we will move on to the dorsal branches. Here we can find the dorsal branches here. Yes. So these are the dorsal branches of the abdominal aorta. So these actually the dorsal branches represent the somatic intersegmental arteries, and these are distributed to the body wall, and these arteries are lumbar arteries. The lumbar arteries are 4 pairs, 1, 2, 3 and 4. 4 pairs of lumbar arteries are arising from the dorsal aspect of the abdominal aorta, and these arteries are somatic intersegmental arteries, and these will distribute the body wall. So how many lumbar arteries? 4 pairs of lumbar arteries are present, and the 5th one is called as unpaired artery. This arises at the middle of the abdominal aorta, that means at the termination part. So at the termination of common iliac arteries, this median sacral artery is arising, and this median sacral artery, which is present on the dorsal aspect. Okay, this median sacral artery actually represents the continuation of primitive dorsal aorta. It arises from the back of the aorta just above the bifurcation and runs downwards to the end in front of the coccyx. It supplies the rectum and anastomosis with the iliolumbar and lateral sacral arteries. This is about the median sacral artery. If you see this lumbar arteries, 4 pairs of lumbar arteries arise from the aorta opposite the bodies of the upper 4 lumbar vertebrae. The small 5th pair is usually represented by the lumbar branches of iliolumbar arteries. The main branches are the upper 4 lumbar arteries, which run across the sides of the bodies. You can see which across the sides of the bodies, passing deep to the crura. This crura only we can see in the upper branches only. The remaining are normal, and the remaining branches deep to the psoas major and the quadratus lumborum to end into small branches between transverse and internal oblique muscle. Okay, and each artery gives off a dorsal branch which arises at the root of the transverse processes. Okay, and this dorsal branch also supplies the vertebral canal and also supplies the muscles and skin of the back. Okay, so this is about the lumbar arteries. Okay, so these are all the branches which are arising from the abdominal aorta. And in the next session we are going to discuss about the branches of the major vessels like celiac trunk, superior mesenteric artery, inferior mesenteric artery, and the renal arteries. Okay, like that we are going to discuss in the next session. Thank you.